Good afternoon and welcome to another edition of Money Talk with Melanie. I am your business diva, Melanie Collette, and I'm broadcasting live from Cape May County, lovely Cape May County, New Jersey, via SHR Media and High Place Pundit Talk Radio. You know what? It's 5 o'clock and it's already dark out. I'm so totally bummed out. I just thought I would mention that. It's like completely dark outside. I'm not ready. I had to mention. I just noticed that. I just looked outside and noticed that it was like completely dark. Terrible. But anyway, welcome, Facey folks. How are you? Dave Milner, Daryl, Cook, Antoine. Hi, Claudia, Joseph, Aaron. Hi. Welcome. My guest today is a return guest, actually, author and Washington Times columnist, Dr. Larry Fedewa, also known as Dr. Larry, likes to be called Dr. Larry, and he's returning. I was on his website, and I noticed he had an article. I keep track of all my peeps, all my guests, and he had an article called "What a Free Market Healthcare System Could Look Like." And I thought that would be, originally I had asked him to come on and talk about DACA, and then I saw that, and I was like, what? We should talk about that, because I think a lot of people, are curious about that, or think that, a free market healthcare system would be some kind of disaster if we didn't have Obamacare. Hi, Ricky. Did I say hi to Dave and Norm? Hi. So anyway, Dr. Larry is here. Very excited to have him on the show today. And for those of you who are just doing the audio, I am in the chat on shrmedia.com. So if you're listening on SHR Media and you want to chat with me there, you're like at work or something, and they don't allow the facey, feel free to pop over to SHR Media, and I promise I will rock back and forth for sure, for absolute sure. What other housekeeping stuff do we have to talk about? I'm going to be back on Sirius XM on Friday. It's going to be a long day. That's like the 24-hour day. On Patriot tonight, Sirius XM channel 125 at 9 p.m. Eastern Standard Time, and 6 p.m. if you're on the West Coast, and it's Patriot channel 125. Super excited about that. Always fun. So call in. Like, if you guys are listening, call in. And get your liberal friends to call in. That's just what makes it more fun. I'm just crazy that way. I like that. So do that if you would. Love to have you. Let's see, what else do I have for you? Housekeeping. If you're not following me on social media and you want to know, want a heads up on who the guest is going to be, what the subject matter is going to be, the best way to do that is to follow me on social media at Money Talk Mel. Which is my Twitter handle, or Money Talk with Melanie, which is my Facebook handle. Now, if you want to do the, hey, Julius, if you want to do like the political stuff, if you just really can't help yourself and want to follow me on Twitter on my personal page, which is where I do most of my personal and political posts, that is at NJGOP Diva. I did not name myself that. My former mayor and now committeeman named me that, and for which I'm grateful. So it's now my Twitter handle. Hi, Susan Tui. Hi, Doug. So that's so follow me on my social media, and I'm everywhere else too. Pinterest, YouTube. If you Google Money Talk with Melanie, you will certainly find me there. For show. Hi, Robert. All right. So anyway, what's in the news? Lots of stuff in the news. So Lyft, yesterday I talked about Uber, right? Uber's getting like this mass infusion of money. Well, now Lyft is in the news today. They're not moving to Canada, but they're opening up in Canada, which is, they're going to have Lyft for Canada. Did you know Lyft is valued at $11 billion? Now, I will tell you, I do both because I tend to when I go to Sirius XM, that's the studios in New York City, and I go to DC often for policy stuff, and I Uber or I Lyft, and I don't really care whichever's fastest or cheapest, frankly. I'm going to keep it real with you. But Lyft does this thing where you can ride with other people, and I think Uber does it too, but Lyft does it on like a whole new scale to where it can be like super cheap if you don't care about what time you get there. So so as long as you're not pressed for time, you're good to go. Otherwise, I would not recommend that. But they're going to open up in Canada, and I had no idea that they were doing that well, that they're valued at $11 billion. And they're hot on Uber's tail, particularly because Uber has a lot of scandals going on. And you know, people don't like, you know, scandals with their companies. This is not, I'm not gonna do that one. I am gonna do this one. I always have like a bunch of stories, so you guys know, like I try to have too much information so that I can just kind of pick and go with the flow when the show starts. So sometimes I'm like, I don't like that story anymore. I liked it when I prepped, but now I don't. But I have to talk about this. The Trump travel ban is going into partial effect. And that's the ban that's banning travelers from 6 Muslim countries, Muslim majority countries, from entering the country that don't have any other connections in the U.S. It's going to constantly be fought every time he does it. And the irony of it being, you know, I don't know. That's not where most of the Muslims are. In those countries. I mean, those are Muslim countries, but there still are plenty of countries that are mostly Muslim that can still come here. I'm just saying. So, like, the theory that you're like being racist does not hold water. Indonesia, Dave Milner, the unpleasant blind guy, says Indonesia, majority Muslim. They're not banned. I mean, you know. But they're going to, listen, they're going to keep fighting it. They're going to keep espousing the narrative. That's what they're going to do. That's what they do. So yesterday I talked about how GE was splitting their dividends, meaning if you own stock in GE and you're used to getting 24 cents a share dividend check, you're now only getting 12 cents. And they're doing this big infusion of capital. Well, not surprisingly, GE shares fell 7.2% on Monday. So the stock closed at $19.02, which was the biggest single day drop since April 2009. It's kind of it's a little bit scary if you're an investor in GE. I'm just putting it out there. That's a little bit of an issue. The last story. A well-known investor and co-founder of the firm Draper Fisher Jurvetson is leaving amid harassment allegations. Really? His name is Steve Jurvetson, and this is according to Recode that reported this. Look, should I be mad that I've never been sexually harassed at work by a boss? I'm kidding. But by coworkers many times. And I just never said anything. I just kind of handled it myself with that, which I have my ways, which I won't reveal, but I have ways of handling it. I have cousins. That's all I gotta. So if you mess with me, there's ways of handling it. There's ways of handling it. But I don't know what these people are doing. Like, how do they figure this is going to be okay? And there's a part of me that feels like it's almost like everybody's reporting every little thing. And I could be way off or wrong about this, but I don't know. Like, if I reported every time some dude at work or otherwise, like, said something to me, I'd have a pile of, you know, lawsuits a ceiling high. But don't you have other stuff to do? Like, don't you? It could be me. Listen, he might be guilty of sin. Like, he might have went hard. I don't know anything about the case, but it seems like there's a lot of these cases now, and like everybody is like, I'm being sexually harassed. Well, like, you know, nice dresses and sexual harassment. I don't, not to me anyway. But I'm like, thanks, because that was kind of the goal, was to look nice. So I don't personally get it. I have had legitimate, real sexual harassment, as many women have, and I'm not speaking to this particular case. I want to be clear about that because I haven't read what the deets are on it. But I'm just commenting because it seems like there is just a rash of these accusations going on that are a little scary. Anywho, that's the last item on Money Talk News Report today. You're listening to Money Talk with Melanie. I am your business diva, Melanie Collette, and we will be back in a few moments with the one and only Dr. Larry Fedewa.
If you are a Trump-hating rhino Republican who looks the other way when Democrats literally set out to destroy the Republic, prepare to be booted out of office. Hello, I'm Ron Edwards. On today's page from the Edwards Notebook, President Trump clearly stated that the corporate tax rate must be lowered now to make America once again competitive on the world's economic stage. The president even caved into the globalists and settled at a 20% rate. But now, Republicans are seriously considering a one-year delay before cutting the corporate rate. The Republicans are also trying to gum up the works by not issuing across-the-board tax reductions, despite knowing that such measures could cause a repeat of 1981, when selfish politicians delayed tax reductions for a year and caused a recession. President Reagan agonized over the decision to give in to the statist politicians who persuaded him not to oppose their delay of granting tax relief for the people of America. I pray that Republicans will awaken from their stupor of pretending not to understand that tax cuts bring in more revenue and the wasteful spending must be curtailed. For you Trump haters, he is doing his job, and it is past time you do yours, or prepare to be booted out of office. I'm Ron Edwards. Sponsored by the Tri-County Liberty Coalition.
Who likes paying taxes? Nobody. That's why Eva Rosenberg from TaxMama.com wants you to pay less of them. Read Small Business Taxes Made Easy and learn how to set up a business plan that minimizes taxes, the tax benefits of different forms of financing, spot and fix errors in the 1099s, legally increase your deductible expenses with better record-keeping techniques. Don't let the IRS squeeze you out of every penny. Start deducting today. Visit TaxMama.com. TaxMama.com. That's TaxMama with one M.com.
My name is David Barnett, and I've been helping people buy and sell small and medium-sized businesses since 2008. So far this year, I've gone on 5 vacations. It's because I've got my own business. When you get tired of being managed by someone else and you decide that business ownership is right for you without the risk of starting your own unproven enterprise, then come over to businessbuyeradvantage.com. There are over 100 YouTube videos on buying and selling businesses that you can watch for free. That's businessbuyeradvantage.com.
Okay, we are back. You're listening to Money Talk with Melanie. I am your business diva, Melanie Collette, and I'm happy to have as my guest today Dr. Larry Fedewa. I was going to say Dr. Larry Fedewa, PhD. That's redundant. Anywho, he's a conservative commentator on social and political issues. He's also an author. He writes for the Washington Times. He's a former international technology executive, business owner, and college president. And he lives on an Arabian horse farm near Washington, D.C. Now, Dr. Fedewa has been on the show before, but I want you to know that he has a new book coming out, a memoir. He has had a very interesting life, so you're going to want to check it out. He's telling the stories of his adventures from a Catholic seminary, going from a Catholic seminary to a happy marriage, with many stops along the way, some funny and some surprising. So I'm very, when you hear his voice, you're not going to be surprised by this, that he was a cabaret singer in Europe, a clothing model in Paris, and a quasi-legal peddler in Denver, among other activities. So, besides all of that, Dr. Fedewa is absolutely brilliant on all things public policy. And so I wanted to have him back on particularly since we're talking about healthcare. And I wanted to talk about what a free market healthcare system would look like. So without further ado, Dr. Larry Fedewa, how are you this evening?
I am fine. I wanted to get in one comment on your last topic, and that is a quote from Paul Boyd in the Daily Wire a couple of weeks ago. He said, when knights surrender their swords, beasts will devour maidens. And I thought that was a very arresting way to talk about this business of all these female being assaulted or at least harassed. Basically what he's saying is that where were the men? Like for example, this Harvey Weinstein, there were a lot of men around there. They all knew what was going on. Why didn't they stand up for those women and tell this guy to take a walk or stop doing what he was doing? And I think that there's a lot of truth to that. So I just thought I'd throw that in for your speculation.
You know what? I'm sitting here with my mouth open because I'm going, you're absolutely right. That is an excellent point. Yeah, I mean, you're right. Where were they? Were there no men around? Not any real men, clearly.
No, they're afraid to speak up. You know, they've lost their swords.
Amen. Amen, Larry Fedewa. And now, ladies and gentlemen, you know I have the brilliant Larry Fedewa on my show, and consider myself to be very fortunate to have him on my show today. And I appreciate your commentary on that very much. You know, that's not even what I brought you on here for, but I'm glad that you said that, because that is such a great point that you just brought up. Where were the guys? All of them. I mean, really. And like I said, I know you heard my commentary that if somebody messed with me, I have cousins. I got people for that. I won't be messed with like that for long.
They haven't given up their swords, apparently.
No, they have not. No, they have not. Yeah. Absolutely not.
Yeah, I think we need more men that are willing to stand up for what they think is right, no matter what the cost.
Indeed, and you know that's another important point. You know, if you're, you know, people who are willing to give up someone's safety for what? Fame and money? Is it? I'm not sure that they at this point feel it's worth it. I hope they don't anyway. But anyhow, we are. Thank you so much for those comments, though. Very, very important point. So I brought you on to talk about this blog that I saw. Very, very detailed as usual, well researched and informative blog that you have. But one particular post I saw of yours that said, you know, what a free market healthcare system would look like. And, you know, I feel like it's a question that, you know, has not really been readily answered and can't really be answered in the, you know, 10-minute sound bites that you might see on the news, you know, and you did a really thorough job of answering that. So on the shell level, what does that look like? An overview.
Yeah, basically, what I said was that in the summary that in order to get to a free market health system, we have to do three things. We have to increase the supply of medical practitioners, and the real issue there is we do not have enough doctors and medical professionals. And if you go down the list, I was looking for I don't know what I was looking for, some kind of doctor in adjoining a small town here in Virginia, and I saw practically, I would say 85% of all the names that came up on Google were foreign names. They were not. Now they might be Americans by legally, but there were so many that were from other countries. And why is that? Why don't we have superabundance of American-born and American-educated practitioners? Is it because we don't have enough Americans that want to give up their Saturday golf game for surgery, or because they don't want to spend their lives helping other people? If that's not the reason is money. It's so damn expensive to go to medical school now that most Americans can't afford it. So what they do is they get these foreign scholarships that many of which, by the way, are funded by the United States government. So my solution to that is we should stop worrying about the supply of doctors in rural or slum areas. And what we should do is we should just say, okay, any American who is qualified and motivated can go to any medical school he wants, and we'll pay for him just like we pay for military officers. And if we give him a free ride, then we would like to have him do, say, a couple of years in in some kind of a hard, scarce medically deprived area of the United States. But we spend so much money on health care, and what do? We structure it so that fewer and fewer Americans can actually become doctors. That's crazy. And so I say the first thing is we have to increase the supply. Then the second thing is really the big one. Well, that's big too. If we had more doctors, we would have more specialists. We would have a much higher level of care. My sister, for example, needs a special type of infectious disease specialist, and she lives in the state of Michigan. There were only 3 places in the entire state of Michigan where there was a practice like that, and in order to get into one of them, even to be looked at, the one that was the soonest date that they could see her was something like 2 to 3 months. I mean, that's crazy.
Now,
we've got a lot of smart, dedicated people here that we could, if we had more physicians, for one thing, we would be able to have a higher quality of service, but we would also, by the way, start getting a lot more people in that market, which would level out the compensation as well.
That does make a lot of sense.
That's number one. Number two, when you look at, you need to know how you're going to finance this thing. So you need to create a patient-centered system instead of a insurance company-centered system or a government-centered system, or even an employer-centered system. Those are all false leads. What we really want to have, in order to have a patient-centered system, we have to have the patient in charge of the therapy. And the only way to do that is for the patient to pay for it himself. So how do you get there? Well, number one, you get let's take a breakdown of the charges. There's about $3.5 trillion a year are spent on healthcare. Of that, approximately half of it goes to government, and 39%, which is almost 40%, goes to insurance companies. Now, if you let's just for the sake of argument, let's say we got rid of government in healthcare, we could probably reduce the overall cost of all the bureaucracies, both at the state and the federal and even the local level, that are supported by our tax dollars. They don't have anything anything to do with curing people or with taking care of patients or keeping hospitals going, they're all about paperwork. They're all about how does the money flow and who gets what and so on. And then the insurance companies, God never said that insurance companies have to have the obligation of deciding what kind of therapy we're going to get if we have something wrong with us. We go to the doctor. The doctor says, "Well, this is what I think needs to be done." And then the next thing they say is, "Well, we got to make sure that the insurance company is going to pay for it."
Yes.
That's crazy. We should be able to pay for it ourselves. And if we did, we would have a lot more scrutiny as to what kind of product we're getting.
And you know what's happening now? Not to cut you off. I just wanted to mention this because I was listening to the radio the other day, and they were talking about how now that euthanasia is legal in some states, that many of the insurance companies are saying, well, instead of that really expensive treatment that's only going to prolong their lives another 3 months, why not just give them a $5 pill and let them, like insurance companies are legitimately saying that. And because of HIPAA,
that's extreme, but that's certainly in our future. We've already got committees and groups that are in charge of those kinds of decisions. You don't have to say, well, we're going to recommend euthanasia, but you can say, well, it's going to cost $150,000 for you to take that cancer cure for your grandmother, and here's some other options, and one of which is euthanasia. Well, you don't have the $150,000. You might want to, that's very persuasive. It's indirect, but it's terrible. It just shouldn't be done.
exactly.
So we should not have insurance companies in charge of therapy. About 1/3 of the $3 trillion in the health system actually ever gets to the practitioners, who are the people that it's all set up to provide. So the first thing we have to do is get the employers out of the picture. There's nothing that says in the world that the employer is supposed to be paying for health care for everybody that works for them. The reason where that came from was there were some people, probably some of our socialist friends, that said that people aren't smart enough to put money aside for their own health care. So therefore, we're going to have to compel them to do that. And to do that, we'll go ahead and make it a mandate for employers to take care of all the health care of all their employees. Well, that's just an added cost. That's about 30% of the entire cost of healthcare is running it through all these different companies with all their different norms and ways of going about it. So that's another way to cut down cost. And then the third way is tort reform. Well, first of all, getting rid of state barriers. If you're in the insurance business these days, you have to have 50 different companies in effect in order to be able to be active in 50 different states.
Yep.
Because every state has its own little quirks in their way of going about it.
Yeah, I have a life and health insurance license.
That's crazy.
I have a life and health insurance license, and the licensing process is ridiculous. By the way, they're two separate licenses, and the information overlaps. It's ridiculous. So you have a life license and a health license. And if I get one in, for example, one in the state of New Jersey, and I want to get one in DC, I have to deactivate my license in New Jersey, then get a residential one in DC, then reactivate the whole system is whacked and completely inefficient. Yeah. Totally inefficient.
They should have nothing to do with it,
Yep.
I mean, I can understand a state function as being legitimizing to show that people really have medical degrees and that they're registered and that they're legitimate. But enforcement issue. That's not a health issue.
Indeed. Indeed.
So anyway, you get the employers out of it, and you get the insurance company's role. There is a place for insurance companies, but I think it's mainly in catastrophic insurance, which radically reduces the role that insurance companies should play. And there's no reason why if you get the employers out of the picture, and the insurance companies per se out of the picture, then there's no reason that you couldn't have a group of people in your church or a group of people in your industry or your union or wherever you want it, and that they could all get together and go and get group rates. There's a group in I think they're in Alaska. I'm not sure where they are, but anyway, it's a group of church people, and they are paying each other's medical bills, and they have a slight, a relatively reasonable membership cost, and it's going great guns. It's the fastest growing healthcare system going. There's no reason we couldn't be doing that. You could have the Legion of the Foreign Legion. The various veterans groups and various scouting groups. Anybody. You could have credit bureaus. Credit unions get involved. There should be a real competition for people to be able to join different ways of financing their health care. So if you could get, and you don't need the government. You need the government for law enforcement, yes.
Right.
But you don't need the government to be having a huge Medicare program or a huge Medicaid.
Now let me ask you, on that point, what you just said about the tort reform, by understanding and being able to purchase across state lines. Now, my understanding is that there was an executive order signed allowing that. I'm not sure when that was supposed to kick in, but the way insurance premiums work, they kind of set them for the year, and they really don't change once open enrollment has started.
Well, that's because you have a government-run healthcare system.
Right.
Not 100%. But you take the Medicare people, take the Medicaid people, take the Veterans Administration. Of course, that's a little different, but there are a lot of different ways that can be handled, and it should not be part of the employer's cost of doing business.
I agree, and it has. The cost of healthcare. They told us with Obamacare that if you have employer insurance, it's not going to affect you at all. Really? Well, guess what? It is sky high. Listen. I'm one of the privileged. I'm a teacher, and what they used to do, teachers never had to pay anything, which I never, quite frankly, agree with, because I'm one of the few conservatives that's a teacher. But they were losing their minds because they had to pay anything, and I was like, okay, let's calm down. Like, the rest of the world has to pay for their insurance. Why shouldn't we? Why should the taxpayers have to pay for all of our insurance, which is the way it used to be? But now we have to pay for it. But I will tell you, ever since then, which has been like maybe since Obamacare was enacted, like the year after that, we started having to pay. It is going up and up and up significantly. Like, we're not talking about, a couple bucks, talking about, a couple $100 a month, that it is really going up. I don't think that people who have employer-based healthcare are getting away with anything like they used to. I think the whole, redistribution of wealth went very well with Obamacare, because that is exactly what happened.
The employer mandate, though, has been there forever. It's been there since Roosevelt.
Right.
But when you took that, Obamacare took that mandate, and then they started screwing around with it. they said, well, you can't have, you can't, if you have 50 people or more, then you have to pay, then you have to pay the whole thing.
Right.
If you don't, then, and so everybody started getting 39 hours and less than 50 employees. So, you want a recession? Hey, that's a good way to start it.
Absolutely, it is. We're up against the break, but when we come back, I want to talk about your third point in your article, which was insurance companies and the government, because I think that's probably where most of our problem is with the healthcare situation. You're listening to Money Talk with Melanie. I am your business diva, Melanie Collette. I have Dr. Larry Fedewa on, and we're talking healthcare and what a free market healthcare system might look like. We'll be back in a few moments. Welcome to this week's Money Talk Minute with your business diva, Melanie Collette. This week, we're going to discuss interest rates. Why are they important? Well, they're important on two sides of your financial coin. On the one side, you have your debt, credit card debt, loans, and things like that. You always want to get the lowest interest rate possible. Why? That means that money is costing you a lot less to borrow with a lower interest rate. And speaking of that, when you're looking at which loan or which credit card to pay off first, you're always going to look at the interest rate. Which one has the highest interest rate? That's the one you want to start paying off first. On the savings side of the financial coin, what kind of savings account do you want to open? Which one should you choose? You will always choose the one with the best interest rate. And on the savings side, the best interest rate will be the highest interest rate. This means it will yield you the highest amount of return. And that's it for your Money Talk Minute of the week. I am your business diva, Melanie Collette.
Power brokers use corrupt politicians, deceptive Islam, and lies from establishment media to turn the once shining city on a hill into the city of the blind. What do the elites fear? One man with a cane. I'm Dave Milner. Join me at SHR Media, High Plains Talk Radio, Spreaker, iTunes, and YouTube for a different kind of commentary on the unpleasant flying guy. Because truth is not always pleasant.
Hello, I'm Tim Hart. I'm the guy BZ hires due to his shameless contract with the SHR Media Network to voice his promos. He'd like me to tell you that the Bloviating Zeppelin's Berserk Bobcat Saloon radio show can be found on SHR Media Network, Spreaker, and YouTube every Tuesday and Thursday night at 11 p.m. Eastern and 8 p.m. Pacific, featuring right thinking from a left brain and doing the job the American media maggots won't. You'll find that the speech is free, but the drinks are not. There, in the saloon, just when safety pin manufacturers are running out of metal for the diapers of the leftists, BZ is sending his personal drones of freedom into the wheelhouses and obstacles of lovers of sovereignty and liberty nationally and globally. Broadcasting behind enemy lines in occupied California, BZ swears that no rights were harmed in the making of this promo.
From the war front to the streets of our nation's capital, men of faith, Dr. Michael Jones, the underground professor, and Kenneth McClinton, the exceptional conservative, bring both constitutional gravitas and spiritual perspective on today's issues to the most influential Christian urban talk show, 9:05 p.m. Eastern, Thursdays. It's a new day on New Day, Black and Red.
The best late-night conservative talk show in America, Blackheads Radio. And listen, there are no people better on the air to give you the best in conservative talk. Blackhead John and Blackhead Clint. And we're working on immigration papers for certain other guys that work here too. For those who are tuning in around the world to the best in late-night conservative talk, Blackheads Radio.
Welcome back, ladies and gentlemen. I am your business diva, Melanie Collette. You're listening to Money Talk with Melanie, and we are talking to Dr. Larry Fedewa, who is talking to us about what a free market healthcare system could look like. And before the break, I asked him about, I was talking to him, this is actually in relation to an article he wrote for his blog with the same title. And I was asking him what role insurance companies and government have in stopping the free market, or what role they could possibly play to work together. And I think we were kind of beginning to work on that topic, but it's very in depth. And that's the whole problem right now, that the government is way too involved in our healthcare system.
Yeah, and so are the employers because of the government, and then so are the insurance companies because of the government. So if you could get the employers out of it to begin with, and then, you know, people say, well, then how could I afford health care? Well, first of all, the money that the employer is spending on your health care every month would go to you directly.
Exactly.
So you wouldn't be out any money. Then the next question is, how do you use that money to take care of yourself and your family? And the answer to that is you do two things. One is you probably keep an emergency fund in a health safety account which doesn't have any taxable effect.
Right.
And then but the other thing is you join some of your neighbors and you put together a RFP, a request for proposal, and you have the insurance companies compete for your business.
Exactly.
And that's how you pay for it yourself. But the effect of that is that you are now the arbiter of your own healthcare expenses. You're the person who decides whether you're going to keep grandma alive or not. You're the person who decides whether you are going to try to. I mean, I just came from the hospital myself, a 67-year-old business owner that I've known for a long time, and he's had a massive stroke, and he's in bad shape right now. But you know, who would be paying for that? Well, you would have your catastrophic insurance. I think there's still a place for that. But if there were 5,000 of us together in one group, and we wanted to negotiate with 3 insurance companies for catastrophic insurance, we could get a pretty good deal.
Indeed.
And there's no reason that we can't just go out and form our own groups and get good competitive rates and take care of ourselves. There's one other factor here, though, that we do have to think about, and that is, what about the people that don't have any money at all?
Right.
And you know, they have to be taken care of. But what do we do with people that don't have car insurance? Well, you know, we have a state-run. That is a function I think a state could have, and that is that they have a pool that is available for the truly indigent, the truly poor, who really don't have any money.
And don't we have that via Medicaid? Isn't that what Medicaid is and Medicare? Am I wrong about that?
Well, that's what it was designed for, but that's not what they're doing. What's really happening is that the hospitals are taking the brunt of it, because people like that go to a hospital and the hospital can't turn them down.
Right.
So they treat them, and then they get the bill, but the bill can't be paid. And most states, they just have to swallow it. And I think that should be stopped. I think there should be, if the state wants to get in on this, they can get in on it at that level, because I think that is a real need, and it's a common need, and it is justifiable. But you know how many people are in that position? There's something like less than 10% of the entire population. So it's not a huge deal. Wow.
Now, I mentioned earlier that we had an executive order that the insurance companies that you can purchase across state lines. But of course, that's just an executive order. It's not the same as Congress passing it. And, you know, I don't know about you, but I'm concerned, And I don't feel like the insurance companies have moved on it at all, probably because it's not really a law. It's a recommendation. I mean, that's really all an executive order is. It doesn't have the same teeth as Congress passing a law and saying so.
Well, no, for one thing, it's only as good as the tenure of the president that does it.
Exactly. So why would insurance companies, considering the amount of money that is at stake, why would they take it seriously? Because I feel like they haven't. Like you heard about the executive order, but you haven't heard anything else.
They don't, because of Obamacare is still there.
Right.
Obamacare is still being run on the state level. I mean, it's segregated by state.
Right.
Each state has its own program.
Right. That's true.
Subject, of course, to federal rules, which are pretty stringent. And that's why they've got to get rid of Obamacare. It's nothing but a big obstruction. Talk about a swamp. That's the one swamp that really needs to be cleaned.
And you don't hear a thing about tort reform, which you mentioned earlier. You don't hear anything about tort reform anymore. I don't. Have you? Anything new on that front?
Well, I think that the medical attorneys that do those big suits are going to somehow or other they're going to be curtailed. Now, if the Democrats get back in charge, you know, those medical people like remember John Edwards, what was his name, John Edwards?
Yeah.
You know, they make millions of dollars on these cases where they get the whole crowd of people, and then they sue somebody for billions of dollars, and of course they take a big chunk of it. They usually take somewhere between a third and 40%.
Yep.
So there has to be a cap on that. You know, everybody makes mistakes. I don't care whether you're a physician or a clergyman or the Pope. You make mistakes, and you cannot say that if someone slips or makes a bad judgment in a surgery, that you're going to necessarily take away their entire livelihood and everybody else that in their insurance, the insurance that these physicians have to carry in order to protect themselves against that kind of a lawsuit are enormous.
They are.
They're like sometimes $1 million a year, depending on what you're doing. So, you know, there's just there's no common sense in any of this. I mean, it's all just crazy.
You're right.
If you've got something wrong with you, you should be able to go to your doctor, and if you trust your doctor, you do what he says, and that's how you operate.
Exactly.
Why get all these other people involved?
Exactly. And you know, on the free market side, that there is a birth of a new area of medicine. It used to be commonplace back in the day. Now we have a resurgence, if you will, of concierge medicine, which I think is a good thing.
That's a good start.
It is. It's definitely a good start. And I think, especially if you can afford to do, if you're young and healthy, you may be able to afford to do just that, and maybe catastrophic. I think it's probably a great combination. You know what I mean? If you're, I don't know, some healthy 20-year-old, you're probably fine with paying $50 a month for concierge care, where the doctor will come to your house and getting an inexpensive catastrophic policy, rather than paying the hundreds of dollars a month for Obamacare and things like that. It's definitely something to look into. I've looked into it a few times. And because it's a free market situation, you know, that industry is getting better and better. It's getting more expensive. They're offering more things. I mean, there are concierge services that are offering, you know, testing and MRI and all that stuff, cash. And if you pay cash, it's cheaper.
What we're calling concierge services is what 50 years ago every physician did every day.
Right.
They went to see the people instead of the people coming to them. But
Exactly.
it takes a lot of physicians to do that, and that's where the shortage of medical professionals really kicks in, because right now we don't have enough physicians to be able to make house calls.
Indeed.
So, we've got to solve the supply problem too, as long as not just the demand.
Indeed. Before we go, we're at the close of the show, but before we go, tell everybody where we can hit your blog up for all of your commentary, and get your book.
Okay. The name is spelled Fedewa. F as in Frank, E, D as in David, E-W-A. Lawrence Fedewa, Larry Fedewa. And the website is called www.mypoliticalinsights.com. And let's see, on that you get most of my Washington Times columns too. Plus, I've started including some columns from other people too.
Excellent.
And then I have the newest book I have out is called Inside: The Early Years, and the subtitle is a Catholic youth searches for his place in the sun, and it's not very political, but it has to do with my early years when my other title is A Love Story That Starts in a Catholic Seminary, of all places.
That should get the book off the shelves for sure.
Well, I had quite an exciting few years there.
I'll bet.
But it's doing pretty well. You can get it on Amazon. Both you can get a Kindle or a paperback.
Excellent. Excellent. I want to thank you so much for being on the show today. Fantastic insights as usual. Great information. I wanted people to get a picture of the possibilities of a free market healthcare system, which you did a great job of. I'm hoping somebody in the Capitol Hill is listening. One of my sponsors also did